Oral cancer probably is the deadliest human affiliation. The term cancer imparts a fear among the common man and even more to medical professionals because we still do not know where we stand, at least in terms of oral cancer. Oral cancer, as estimated by WHO, is the sixth most common cancer worldwide. Nevertheless, this term is synonymous with oral squamous cell carcinoma of the oral mucosal origin. Okay, so this is something that we all should understand. Carcinogenesis is a multi-step process which involves accumulation of both genetic and epigenetic alterations in oncogenes and or tumor suppressor genes. In the course of this progression, visible physical changes are taking place at the cellular level, which is actually referred to as atypia, and at the resultant tissue level, which is called dysplasia. And what clinicians see on the patient is an expression of an unseen process happening at the cellular level and genetic level. So in majority of the cases, what as clinicians we treat is the reaction, but not the action. Coming on to the general definition of oral cancer. So oral cancer is a cancer occurring in the oral cavity, which is basically an abnormal growth found among the mouth region. So malignancy which is occurring inside the oral cavity and affect this mucosa is what is called as oral squamous cell carcinoma. What you should understand is the term oral cancer is an umbrella term, which means it includes all the cancers which are occurring inside the oral cavity, out of which the majority or the major one is your oral squamous cell carcinoma. The ICD classification, that is the International Classification of Diseases, says that cancers occurring on the lip, tongue, buccal mucosa, gums, and alveolus, floor of the mouth, and palate are what are referred to as oral cancers. But this definition does not include the tumors of the salivary glands which are occurring inside the oral cavity and the oropharyngeal region. Oropharyngeal region is a completely different subset of cancer, which is usually occurring in the posterior part of the palate, that is the soft palate, the posterior part of the tongue, that is the posterior 1/3 of the tongue, and the pharyngeal region. See, why this oropharyngeal cancers are very important is because they've got a completely different etiological agent altogether. HPVs play a very, very important role in oropharyngeal cancers. So that itself is a separate topic altogether. So we're not going to touch upon HPVs as of now. So, but to understand what exactly this oral squamous cell carcinoma is, you need to understand a little bit of histology. I'm not going to details of this histology. The oral cavity, as you all know, is lined by an epithelium. The epithelium here is what is called as your stratified squamous epithelium. The reason why it is called stratified is because it has got multiple layers, number one. And number two, not just because of the multiple layers, you will also be able to differentiate each layer based on its appearance. Say, for example, the basal layer, which is here, is cuboidal in nature. The layer on top, which are called as spinous layers or the squamous layers. And finally, the most superficial layer, which is called as a stratum corneum. And within the oral cavity itself, there are areas where these squamous cells can differentiate and produce a proteinaceous product called as keratin. And some areas, they don't have keratin. Say, for example, your buccal mucosa, the same stratified squamous epithelium does not have the ability to produce keratin. Whereas in the hard palate and gingiva, this epithelium has the ability to produce keratin. So based on whether it is able to produce keratin or not, we will call it as stratified squamous keratinized epithelium or a non-keratinized epithelium. And another important thing that you need to understand is the membrane on which all these basal cells rest upon, or these squamous cells rest upon. So this membrane is what we actually denote as the basement membrane. So beneath which you have the connective tissue. So what basically this basement membrane is, this basement membrane is a delineating membrane which separates an epithelium from the underlying connective tissue. So this is what the basics, minimal basics that you need to understand. So as I told you before, what are squamous cell carcinomas? These squamous cell carcinomas are nothing but the cancers or the carcinomas which are occurring primarily from the squamous cells of the oral epithelium. So if those arise from the squamous cells, whether it may be a keratinized or a non-keratinized epithelium, so those cancers or those malignancies are what are referred to as oral squamous cell carcinomas. So this oral squamous cell carcinoma, as you all know, is an effect of multiple genetic mutations which are happening, which can either activate the proto-oncogenes or inactivate the tumor suppressor genes. So the resultant effect of these two, when the proto-oncogenes are activated, there is multiple proliferation. And when the inactivate tumor suppressor genes, which are supposed to remove the defective cells, which is uncontrolled, and then multiple division occurs, the resultant effect of these two is an uncoordinated fashion of proliferation cells, which results in a tumor, which is called squamous cell carcinoma. And in the oral cavity, of course, there are other types of oral cancers, as I told you. One, if it arises from a salivary gland, we call it as an adenocarcinoma. If it arises from a melanocyte, we call it as a melanoma. And if it arises from a lymphocyte, and because it's from a non-nodal region or extranodal region, we call it as extranodal lymphoma. This is just for your understanding, for you to understand. Oral cancer is an umbrella term which will include any type of cancer which is occurring inside the oral cavity. If it specifically arises from the squamous cells, it is called squamous cell carcinoma. And there are other types of cancers which are also there, which are adenocarcinomas, extranodal lymphomas, and melanomas, so on and so forth. So now in this presentation, we are going to restrict ourselves only to the oral squamous cell carcinoma. Now coming on to the epidemiology of oral cancer, specifically in India. Okay, if you see, there are almost 13 lakh new cases which are happening every year. Okay, so this is the number of new cases as per the Globocan 2020 data. Every year, new cases are almost 13 lakhs, and the number of deaths every year is very, very alarming, which is around 8 lakhs per year. Now, if you take the gender-wise data of these cancers, if you see, in males, the most predominant cancer is the oral and lip cancer, which accounts for almost 16.2% of all new cancers. And if you take the combined gender, that is both male and female put together, this accounts for the second most common cancer, second only to the breast cancer. So that is how common this oral cancer is. Coming on to the etiology and the risk factors of OSCC. So as you saw in the video, so this is a very familiar thing that all of you know. The most common or maybe the only common reason is the use of tobacco. So the tobacco in any form, either be in a smoking form or a chewing form, is the most common etiological agent for oral squamous cell carcinoma. And in parts of South Asia and Southeast Asia, there is South and Southeast Asia, there are other forms of products which are also used, either in the form of this leaf, which is called as the betel leaf and the betel nut. Okay, so these are also used, so which we commonly call in Tamil as the vetala and the paku and the sunambu. So this is also another important product, but it is not a tobacco leaf as such. So this is the betel leaf. Okay, so this also has got certain compounds or products which can precede or which can lead to oral cancers. And the most important of all the etiological agent is one form of tobacco that we use in the form of powdered form. So these tobacco are used in chewable forms. So if you see the incidence of oral cancers, more than cancers which are caused by smoking, the ones which are more predominant are the ones which are caused by the chewing forms of tobacco. So all these three are established etiological agents for oral cancer. Apart from this, you also have alcohol, but alcohol, the role of alcohol is very debatable. Alcohol, there is no clear evidence that alcohol on its own plays a very important role, but when it is used in conjunction with tobacco, it has a synergistic effect where the alcohol can cause easy dissolving of the tobacco products and gain entry into the oral mucosa to produce its desired carcinogenic effect. Okay, and there is a new avenue which is called HPV. HPVs also are playing a very, very important role in the etiology of oral cancers as of now. But HPVs mainly they cause cancers of the oropharyngeal region, okay, and the tonsils as well. So that is important one. And immunosuppression is another important factor which may predispose a patient for oral squamous cell carcinomas.